Hello, everyone. We had a little change of menu today. I hope you don't all mind, but it was very nice. Thank you, Hudson Valley Hospital Center, for rectifying the situation so quickly. Could we all rise now for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, now we'd like to have a moment of silence to remember all of our first responders, our veterans, and all that are in need. So let's have a moment of silence. Thank you. I'd like to introduce ourselves, members. My name is Rosemary Panio. I'm chair. Jenny, introduce yourself. Jenny Menton.
I'm Darrell Lindholm, secretary.
Francis T. McBetty.
Go ahead, you go.
Ed Lachterman, councilman and liaison to the senior committee.
Serafina Mastro.
Deborah Marks, member of the committee.
Who's back there? I can't see. Diana, is that you hiding?
Yeah.
Okay. Diana Quast, our town clerk. Of course, we always want to say thank you to our veterans and our first responders. The work that they do, the veterans work they have done, and the first responders, lately I've seen a few situations where first responders were called, and I tell you, we couldn't thank them enough. So we ought to remember them and think about that.
Can we ask the first responders, any first responders and veterans in the room to stand?
Are there any first responders or veterans in the room? If you would just stand.
Any first responders or veterans? Ron, I know you're a veteran. Stand up.
Stand up.
Thank you.
Thank you. Okay, today we're going to have Wendy McNamara is here from New York Presbyterian Hudson Valley Hospital. She is the coordinator for community affairs. So she's going to have a few words, and then we will ask you if you have any questions. We will have courtesy of the floor after each speaker. So if you have any questions, hopefully we can answer them. Wendy, thank you.
Hi, everybody. Hello. Happy New Year. Great to see everybody. Wishing you all good things in the New York and Hudson Valley Hospital. And I want to personally thank Rosemary and the entire board for being so supportive and welcoming and helping us to continue to spread our message to you and let you know that we're right here. New York Presbyterian Hudson Valley Hospital is your neighborhood hospital serving the heart of the Hudson Valley community with specialties in cardiology, cancer care, digestive health, orthopedics, obstetrics, and gynecology. Today's speaker, who I'm so happy could make it because I've wanted her to come speak to you for a long time, is Karen Erickson. She's our pharmacy manager. Karen Erickson is a doctor of pharmacy, board certified in geriatrics. Karen joined New York Presbyterian in 2004 and has held various management roles. Karen has worked in the retail pharmacy as well and enjoys counseling patients in taking their meds safely to avoid unnecessary hospitalizations and ensure the effectiveness of medications. And that is why she is the speaker we wanted today. It is my pleasure to introduce Karen and the important information she is about to share on taking your medications safely. Take it away, Karen.
Thank you. Thank you very much. Hi, Karen.
Hi, everyone. So excited to be here. Thank you so much for having me. And thank you for the introduction, Wendy. I really appreciate it. So today's topic, as Wendy mentioned, is about taking your medications safely, right? I'm sure that's something that is near and dear to your heart because I'm sure that many of you take medications, maybe 1, 2, 3,
10,
or 5 or 6. Yeah, we'll talk about that and the challenges that we face and how can we overcome them so that we can take them safely and prevent hospitalization or unnecessary side effects. So First, we'll talk about illness and the role of medications, and as I mentioned, the obstacles that you can face while taking medications, and then how to take them safely. So there's different dosage forms, and it's important that we administer them correctly and handle them correctly, and hopefully you'll get some tips. I want this to be interactive, so please, if you have any questions, stop me, ask, I'm happy to further the conversation, but I want it to be interactive rather than me just stand here and just give you all the information, okay? How's that?
Thank you very much.
Very good. Okay, so first part of the interaction, let me see how knowledgeable you are. I know there's a lot of smart people in the room. Why do people get sick?
Their
Right?
immune system is down.
Right?
It's a
So,
good question.
right?
They're
Think
immune.
about it. Why do people get sick? So it could be various reasons. Genetics, increased age, just so unfortunately the older we get, the more susceptible we are to getting sick because our immune system is not that strong. So it's important to keep ourselves healthy. There's also environmental exposures, right? That we could be inadvertently exposed to that make us sick. Stress is a big component, right? Who's ever gotten sick over stress, right? Unfortunately,
We don't
yeah.
admit to that.
Yeah, we won't admit to it, but it happens, so we have to be mindful of that. Poor diet as well, right? If we're not taking care of ourselves and eating healthy, we're susceptible to getting sick. And then having a sedentary lifestyle. We all know that we should exercise or walk at least 30 minutes a day to get our heart, our cardiovascular system, maintain it strong and healthy. And I always say a body in motion stays in motion. So always remember that. Okay? All right, so what are the role of medications? There are different roles for medications. What do you guys think? Preventative is one. We also take it to cure, right? To cure a disease,
And also to slow down.
to slow down chronic conditions, correct? Thank you. To provide symptom relief. So when we have, for example, a cough and cold, we can't cure a cold, but we can treat the symptoms and just wait until we get better in a few days, right? Delay disease progression, as you mentioned, decrease the burden of the disease, increase lifespan as well, and improve the quality of life overall. So, because medications play such a huge role in our lives, it's important that we stay compliant with our medications. Consistency and accuracy in following a medication regimen becomes very, very important. It's essential to gain the benefit of the therapy, to minimize the side effects and drug interactions, and noncompliance also leads to suboptimal outcomes. So it's very, very important that if you are on a medication, if you are in a certain treatment, that we stay compliant. But we know that there are obstacles, as I mentioned, right? It's not so easy, especially if you take multiple medications and you have multiple disease states. So you may have diabetes, high blood pressure, arthritis. Those are common ones, right? All together, and you're taking medications for all of them. And in fact, studies show that the more doses you have to take during the day, the less compliant we become. So for example, if you have to take a medication just once a day, do you know what the compliance rate is? Just take a guess.
100%?
90%.
90%.
Just once a day. It's only 90%. It's not 100%, but 90%. And it goes lower the more we take it. So if we take medications twice a day, the compliance is only 60 to 70% for a twice-a-day medication. 3 times a day, at least 50% if we're lucky. And 4 times a day, 30 to 40%.
Wow.
Right? So you get the picture. The more medications we take, the increased frequency that we take, the less compliant we tend to be. And also there's differences in formulations. So you may just take your eye drops, but then you have to take tablets, or you may have to inject yourself, right? So that also is a barrier. Additional obstacles, what else? In addition to having to take things multiple times a day? What are other obstacles that you personally may face with taking medications?
You forget.
Not convenient, right? Okay.
Time of the day.
Financial, yes, that's a number one. Yes. What did
I say you forget, somebody else said find.
forget, right? You need reminders, right? So remembering minimum knowledge also of medications. So if you don't really understand why you need to take something, you're less, likely to stay compliant. Also, a number one reason also with, for example, high blood pressure patients. You don't feel any symptoms necessarily unless your blood pressure is shooting through the roof. So you may feel like you don't need to take your blood pressure medication because you feel fine until you don't feel fine, right? Because you haven't been taking it. So there are silent, killers that, you need to be aware of. So chronic diseases that may not necessarily give you symptoms every day, you need to be compliant with taking those medications. Yes, ma'am.
Is it better to take high blood pressure medicine in the morning or at night?
So I always say follow your doctor's orders. He may know the special reason why you need to take the medication, but I recommend, if there's no other concerns as a pharmacist, I like to tell patients to take them at night, right? Because sometimes some patients experience dizziness in the morning when they take it, and if you're taking it right before going to bed, you won't experience that, right?
Hopefully you're asleep.
Right, if you go to sleep and you're not getting up 10 times, in the middle of the night, then, that's an alternative, right? But everybody's situation is different, but just from that perspective, if it's just dizziness that is bothering you, I recommend taking it at night. Okay? Yes?
If you take more than, like if you take cholesterol medicine like that, is it better to space them during the day, or is it better to take all your meds at one time?
So it depends, again, on how your doctor prescribes. Sometimes you can take them once a day in the morning. And we'll go over the different interactions. There are special circumstances and drugs that you have to take specifically as directed, such as warfarin. There's certain interactions. We'll talk about that. I will get into that. But I would say you can take them at the same time of the day, just depending on the type of medications and if there are no interactions. And your pharmacist can easily check that for you when you're picking up your prescription.
Wouldn't your doctor also, or shouldn't your doctor also forewarn you about that?
They can, but pharmacists are medication experts, and that's really our responsibility. So the physician writes the script. We're responsible for filling it and counseling you on how to take it. So ultimately, we want to make sure that you're taking it safely, right?
I find that the pharmacists are really very, very helpful, very helpful.
Yeah, thank you. Absolutely. So ultimately, before you leave the pharmacy, if you have any questions or doubts, your pharmacist is your go-to person. Okay? And usually, if we catch something, we'll call the physician and say, hey, are you sure you meant to write this way? There's a reason why we have to make sure we review the prescription before we give it to you and we fill it. Because if there are any concerns, if it's not written correctly, if it was written twice a day instead of once a day, or it has the wrong strength, it happens all the time. That's the reason we have pharmacists. So we have to make sure that we dispense the medication safely.
And they also know what other medications you're taking.
Correct.
Yeah.
Correct. We have the profile in the system, and we can see your history if you've been going. That's why we recommend going to the same pharmacy, because all of your records are there, and we can see your history and if there are any concerns. That said, we do the same practice in the hospital. Right? So in the hospital, when you're admitted, it's important that you give your list of medications, even if you're admitted for a foot surgery. Maybe not related to the conditions that you have, but we need to know what you're taking, and we will contact the physicians on site in the hospital if there are any concerns, and they will rewrite your orders. So we do the same thing in the hospital at New York Presbyterian. We have a great team of pharmacists there that focus on that. Great questions. Yes, ma'am.
About if you're taking a number of supplements with your medications.
Yeah, we'll talk about that too. You have to be careful. You can't assume that because it's natural, it's an over-the-counter, that it's safe to take with your prescription. It depends on which ones you're taking together. you have to be worried about that. So that's a great question.
Yeah,
Okay, so see, you guys are so knowledgeable. Very good.
because we take a lot of prescriptions.
I know I'm talking. This is always a fun talk. This is why I love it, because I know you guys know what you're talking about, and it's very interactive. And I'm here just to clarify and give you some reminders. So again, the obstacles, that you mentioned: expensive therapies, minimum knowledge of medications. You may not feel any symptoms such as high blood pressure, medication side effects. You may, hate taking a medication because it bothers your stomach, or just doesn't taste really good. So that's a deterrent. And patient forgetfulness, as you mentioned before. So there's ways to increase compliance. As I mentioned, you can work with your pharmacist to design a simplified regimen. Streamline, maybe take everything once a day, or change the timing. As I mentioned, you could take something at bedtime as opposed to the morning time. All of these timings and adjustments can help decrease side effects. In terms of affordability of medications, we know that that's a huge barrier, as you mentioned. So we can inquire about financial assistance. There's a lot of drug companies that offer assistance programs that we can investigate, and we do that even in the hospital setting for outpatients. Doctors at times have samples in the office that can help get you started, so you may have benefited from that. Your insurance may have some benefits associated that we can investigate. And also, always go for generic. Most of the time, you have a generic alternative, which is cheaper than the brand formulation that you may get. And shop around for the best price. You may go to CVS, they give you one price, Walgreens may have another. There is transparency around that, and you have a right to shop around, okay? We talked about increasing the knowledge of medications and their use. That's definitely helpful. One of the goals I have pharmacists actually rounding in the hospital, and right before the patients get discharged, we make sure that they understand why they're taking the medications and the side effects that they can expect. That's definitely part of the care we provide there. So indications, side effects, drug interactions, and following the directions for use, as I mentioned. Everyone's situation is different. You may have special instructions that are provided by your physician, and you can review that with your physician as well as with your pharmacist. You also do not want to overdose or underdose, right? So we want to make sure we take it correctly. And adhere to diet restrictions, and there's also medications reminders that we're going to talk about. So medication reminders, some of them include pill boxes, right? How many of you use pill boxes? If you take a lot of medications, it's good to keep them in a pill box, yes. As you know, they're available in weekly or daily increments depending on the medication regimen you have. It's good to refill them once a week to make sure that you do it accurately and you don't misfill it. And one thing is, I'm sure that we talked about forgetfulness. If you do also fill it once a week, you know that if it's missing for that day, you probably took it. So do not question yourself. Trust yourself. You probably took the medication.
Remind yourself. I took that. Yes.
Yeah, exactly. So fill it once a week, and if it's missing, you took it. Okay, let's assume that so you stay safe. Keeps you organized, and it's easy to carry in your purse. But a couple of reminders also with pill boxes: they're not child resistant. If you have grandchildren that come to visit you, or pets as well, be careful where you leave them around. And it's obviously only for solid formulations like tablets and capsules, not liquids. Another helpful tip are calendars. I don't know if you keep a big calendar in the kitchen where you cross off, if you've taken it, if it's time to refill your prescription. You can personalize it with symbols or colors, whatever works for you. You can also use calendars, and this is where calendars are very helpful. For example, if you have asthma or COPD or pain, and you notice that you're taking your pain medication more frequently than others, you can tick mark on your calendar the number of times you've taken the medications, and you can notice a pattern. Have you taken more Tylenol this week for your arthritis or for your back pain? And when you visit your physician, you can present that information, and that will be really, really helpful to help tailor your medication regimen or treatment regimen. Does that make sense? Okay, very good. Same thing with inhalers. If you have more frequent use of an inhaler, maybe it's time to reassess your treatment for asthma or COPD. A diary or notebook also works well. Same idea. You can keep also logging in your blood pressure numbers as well, or your sugar if you have diabetes. It's a great way to show your physician that you're keeping track and if your therapy is working really well. Other reminders are, you've probably seen alarms or keychain alarms that work, or your phone. Everyone has a phone now, right? We're in the digital era, excuse me. And so a lot of times we use the phone not just for alarms anymore for waking up, but for also reminders during the day if you need to take your medications. So use that as an advantage. Now, the number one standard precaution before we cook, before we take medications, what is it?
Wash your hands.
Thank you. Wash your hands. So before we get into how we administer different medications, I just want to put that out there. We're seeing a lot of infection rates go up in the community, in the hospital recently. The RSV has gone down, the flu as well, and COVID is ticking down a little bit as well. But what we're seeing now is a lot of C. diff diarrhea in the hospital. It's going up in the community. It's a really, really bad form of diarrhea, and the number one prevention of that is hands washing, hands hygiene. So don't forget that. So universal step is before and after use, regardless of the route of administration. And how long do we wash our hands for?
The alphabet. Sing happy birthday.
At least 30 seconds, or sing the happy birthday song, right? Okay, very good.
Are the hand sanitizers
You can
a
have
good
use,
alternative to if you're not near-
correct.
near running water or soap?
Yes, hand sanitizers are just as good to kill germs. The only difference would be if you have something icky in your hand, you definitely want to use soap and water. But for routine, you can definitely use the hand sanitizer. So different routes of administration include what type of routes? You can just yell them out. Oral, right? Patches. Syringes, very good. So injectables, inhalers, we talked about. Eye drops are a popular one for dry eyes, glaucoma. Ointments, right, for pain management, using that icy hot or the different creams for itch relief or
Do
inflammation.
they actually work?
Which one?
Well, if you put an ointment on, for instance, does it penetrate to get to whatever?
Yeah, I mean, it depends. We have really effective ones, and your skin is the largest organ in your body, and it does absorb. So you have to be careful what you put on your skin, and it will absorb it.
Your heating pad sometimes is very helpful.
Oh, yeah. Heating pads are very, very good. So just to review quickly, the tablets. Those are optimal for who can swallow. They're the most convenient and probably the most popular way, right, to take a medication is a tablet. But there could be taste issues. Some tablets may be really large, right, to swallow, so that's a barrier. So ask your pharmacist if there are medications that you can split, because some of them you cannot split or crush, so you have to be very, very careful. They're intended to release over time in your body. So an XL, that means extended release, or XR, that means it's meant to stay in your body a little longer to give you that sustained therapeutic effect. So we cannot crush those. But for the most part, other formulations you can. So just check with your pharmacist. Suspensions. Suspensions can be given through an oral syringe for those that cannot easily swallow a tablet. But the key to remember with suspensions is what? Amount, and you want to shake well, right? Because suspensions, what happens with them is that they separate once you leave them, settle in storage, And before you administer it, you have to make sure that you shake well before using. And only use calibrated droppers so you know exactly the dose that you're taking. Household teaspoons may lead to underdosing or overdosing depending on how big they are. They're not exactly always the exact measurement. And always remember to remove the cap first if it's an oral syringe. It sounds silly, but many people have choked, especially children, I would say, when you don't realize that the cap for the oral syringe was on and you put it in the mouth, and then you can choke. So just something to be mindful of. Patches. I don't know how many of you take patches, but patches, yeah. They're good for areas that are not hairy or oily, or the skin's not broken, so you have to be mindful of that. You also have to be mindful to fold both ends before discarding. So once you remove it, don't just throw it in the garbage. Fold it so no one that can inadvertently touch it gets exposed to the medication. And keep away from children and pets. Rotate the skin area, if you probably do that, right? So the same place does not get irritated. If patches are changed every 3 days, write the date and time of the last placement. So that could be helpful, so you don't forget. You might forget if nothing is labeled on it. Okay, inhalers. Inhalers, you want to shake well before use. You want to also make sure if they're empty or full, right? It's hard to tell, but if you shake it, you can tell. Some of them now actually show the amount of doses left on them, so that's helpful. And make sure that you use the proper breathing technique. So I've seen patients that just, pump it in their mouth, but you have to make sure it goes in your lungs. So make sure that when you are using an inhaler, right before you activate it, you breathe out and then just squeeze it in right before you inhale. So you get that right in your lungs where it's supposed to be. So you inhale and count to 10 and then exhale slowly, or as much as you can. It may be hard to hold your breath for 10 seconds, but try to hold it as much as you can and then just exhale slowly. And then wait another minute before you do the next puff. Does that make sense?
Yep.
Very good. And then you can rinse your mouth after use, especially when you're taking steroids by mouth, so we avoid growth in our mouth, which could be a side effect. Injections. So this includes insulin products. That's the most popular one. All insulin needs to be refrigerated, and it's only good for 28 days out of the refrigerator. We do not shake insulin vials. They're very sensitive proteins. And if skipping a meal, do not inject the insulin for that meal. That's just something to remember. And if you're using different kind of insulins, you always draw up the regular type of insulin first. Okay, and then we always discard the needles in a sharps container. Ophthalmic drops. You also need to shake the eye drops before use. Never touch the dropper tip when you're putting them in, and only use as directed. One of the tips I like to give patients is to refrigerate the eye drops, because when you're putting them in, you can feel the same sensation and it feels cooling. So for the most part, you can refrigerate your eye drops so that they feel good when you're administering them. And basically you want to, after you've washed your hands, as we mentioned, create a pocket with your finger, pulling down your lower lid and just dropping it into your eye, of course, with your head tilted back. And then you'll feel the cool sensation of the drop, whether it's 1 or 2 drops, if the drops were refrigerated. So that's why it helps. And you want to wait 5 minutes between eye drops if you're using more than 1 eye drop. Okay. Ophthalmic ointment. So same idea. You remove the cap. Do not ever touch the tip of eye drops or the tube. If it's an ointment, you pull the lower lid down, as I mentioned, and you make a pocket, and then you just squeeze 1/4 of an inch to 1/2 inch of the ointment into your eye. Release the eyelid and close your eyes for 1 to 2 minutes because it becomes very hard to see after you've put an ointment in your eye. So you want to make sure you close your eyes for 1 to 2 minutes to allow the medication to absorb appropriately. Rotate your eye as well for appropriate distribution. And you may want to do it at bedtime because you'll have that blurry vision. Keep that in mind if you need to go out for errands or driving. That's a good medication that you want to do in the evening that you know you're not going to go out again. So we talked about topical ointments or things you put on your skin. Make sure that the area you're applying it to is clean with water and pat it dry. Apply only a thin film of the ointment to the affected area. Keep medication away from the eyes. It's only for your skin. And do not cover it with any bandage unless the physician asks you to, or the pharmacist. Nitroglycerin, that's something popular. I don't know if anyone's taking that, but there's specific storage conditions for nitroglycerin. It has to be stored in an amber container, which it usually is dispensed in. It needs to be protected from light, that's the reason. And it has to be replaced every 6 months. It needs to be stored also away from heat, light, and moisture. And it's used to dilate, your arteries in the event of a heart attack. So you put it under the tongue if you experience any chest pain. So this is carried around just, for emergencies, and take only if needed. And we do not take other vasodilators such as Viagra or other nitrates along with that. Okay. We mentioned Coumadin, also warfarin, which is a popular drug in the elderly. It's a blood thinner that prevents a heart attack as well. And those that take it know that they have to get their blood checked regularly to make sure that it's within its efficacy range and that your blood does not get too thin, because that's a sign of toxicity. So patients that are taking the blood thinner are more susceptible to bruising, bleeding gums, scrapes that bleed profusely, so you won't necessarily recover from the bleeding right away, and you may see even blood in your urine or stool or sputum or nosebleed. So those are signs of toxicity that we need to monitor with those patients.
What's the difference, if I might ask, between Coumadin, for instance, and other blood thinners like Eliquis?
So they just work in a different mechanism of action, but the same
precautions?
Same precautions, absolutely. Yep. And the thing with warfarin is that it does have the interactions with vitamin K containing foods, so it leads to warfarin resistance. It actually antagonizes it, so because it works through that pathway. So patients that are taking warfarin are counseled to avoid foods that are in high concentration of vitamin K, such as beef, pork, liver, broccoli, Brussels sprouts, spinach. And it's actually not that you can't take them, but you have to maintain a consistent diet. So, when you're assessed and your blood levels are taken, they're taken at the time knowing that that's the diet that you maintain. But if you steer out of that, it'll be harder to adjust your therapy and keep you safe. So you don't want to binge on those foods. You want to maintain a consistent diet and report any significant dietary changes to your doctor, because that may have that impact. So that's the difference. So Fosamax. Fosamax is a popular one, and those in those classes, those are for osteoporosis. As we get older, our bones start to become more fragile, and we're more susceptible to osteoporosis. So with Fosamax and those alike, we have to make sure that you take first thing in the morning with 8 ounces of water, and you cannot lie down for at least half an hour after taking the medication because it can erode your stomach. So those are medications that you have to take specifically as described. And we talked about over-the-counter things, as you mentioned earlier, supplements. They're very popular because we consider them natural, but they're not regulated by the FDA like our medications are. So if you read those supplements, they all have that disclosure on them that they're not regulated by the FDA. And many are effective, but they have potential serious interactions with a lot of the medications that you take. So many herbals contain mixtures of different chemicals, so always inform your physician or your pharmacist if you're taking any over the counter so we can make sure there are no issues with that. If you are taking those herbal medications, make sure, again, you read the label, and they have to be a standardized product that tells you the active ingredient whenever possible, and start with the lowest dose recommended on the label and then increase as needed. So pay attention to the dosage and the active ingredient on the medication. Do not take it if you experience an upset stomach, headache, rash, unusual bleeding, dizziness, yellow skin, or any other side effect. Herbals may cause liver toxicity, high or low blood pressure, lower your heart rate, or kidney failure. There are also interactions, as I mentioned, so make sure that you check with your pharmacist. So we talked about cold and cough medications. If you have high blood pressure, for example, we know that there are a few, Coricidin, for example, can be taken for people that have high blood pressure if you have a cold. Also, a popular one are NSAIDs, or nonsteroidal anti-inflammatory medications such as Motrin, ibuprofen, naproxen, or Aleve. These can all increase blood pressure. I'll never forget, there was a patient that kept coming constantly back into the hospital, and he never really disclosed that he was taking Aleve. And once we discovered that, his blood pressure got back to normal. So it really does make a significant difference. Do not take it for granted. Also, a sneaky villain in cold and cough syrups are the sugar content. So if you have diabetes, you have to be careful with that. Look at the sugar content. Benadryl is a popular one to help sleep at night, but it does cause urinary retention. So you have to be careful with that, and a lot of drowsiness. So you have to be careful and on your activities if you're taking that. Antacids include Mylanta or Tums, and an example of an interaction with a medication is ciprofloxacin, which is an antibiotic that you may have taken for bronchitis or an infection. That has an interaction with antacids. It actually binds to it and it doesn't let it work. So you have to make sure that you take the antibiotic 1 hour before or 2 hours after the medication, right? So I'm sure at some point you've been counseled, do not take these together, wait 1 hour before or 2 hours after to take it. And that's the reason why.
That's the antacids.
Antacids, it could be, but it depends, it mostly with the antibiotics, so you have to be careful with that. There are alternatives if you need to, like Pepcid that you can take, not Mylanta or Tums, that would not have that reaction with. Grape juice. I don't know how many of you enjoy grape juice, but grape juice actually is not friendly with our medications, at least with some of them. It causes increased levels of medications, and thereby it can increase the risk of side effects if we take grape juice with them. So there's some cholesterol-lowering drugs, psychotropic medications, and even warfarin. So drink orange juice instead, but avoid the Seville oranges, because the Seville oranges act just like grapefruit. So
Grapefruit or grape?
Grapefruit.
Oh, grapefruit.
You were saying grape
You were
juice.
saying grape.
Oh, I said grape juice?
Yeah,
I'm
I was
sorry.
wondering, yeah.
Grapefruit. Sorry. Thank you. Yeah, so grapefruit juice. And Seville oranges are similar to grapefruit juice, so you want to avoid those. Not that I'm aware of, no. Yep. And alcohol. Who doesn't like a little wine, right?
Well, that's grape juice, right? Isn't that grape juice?
That's grape
Yeah.
juice. That's the grape juice. But alcohol, actually, we know that red wine in particular can lower your blood pressure, relaxes your arteries. So a little bit in moderation does help. But it can cause interactions with your medications. So be careful if you are taking certain medications, because an acute consumption can actually increase the levels of your medications, while chronic consumption of alcohol can decrease the effects of some medications. So the popular ones are alcohol and warfarin, or alcohol and anti-diabetic agents, and antibiotics. And we know that alcohol can obviously increase your drowsiness. So if you're taking drugs that affect your brain, such as antidepressants or central nervous system depressants, that can also increase drowsiness. And watch out for over-the-counter medications that contain a lot of alcohol too. There's a lot of cough and cold formulations out there that have a lot of alcohol.
What would you suggest, a couple of hours? Could you have like a glass of wine and then take your medication a couple of, because my husband usually takes his medication late at night before he goes to bed.
Sure.
So he would be able to have a glass of wine then at dinner time around 6.
Sure. And again, it depends on what he's taking at night.
Right.
But a glass of wine, I think the doctor would approve of if there are no other concerns. Okay.
Jenny, at Tony's age, he's doing something right.
Yeah, right.
Uh,
The thing is, he's never asked the doctor what size glass, so he always uses his own measurement. So,
that's true. That's a good one.
you
Watch the
know,
portions.
You haven't mentioned Synthroid, which usually we take in the morning.
Mm-hmm.
And you don't drink or eat anything for about a half hour to an hour. Is that still correct?
Yes, actually, I thought I had that in my notes, but
Maybe
thank
you
you for
did, but
bringing
I
that up.
didn't hear it.
No, I didn't actually, but maybe under this brand versus generic medication. So we talked about how that can be a cost-saving intervention. So always try to get generic if you can. There's some exceptions, like with Synthroid, you take the brand for that.
Because I know a lot of people take that. So,
Right.
yeah.
So Coumadin and warfarin are not interchangeable, and Lennox and Digoxin and Synthroid, those may not be interchangeable. So for I would say 90% of the drugs, you can interchange them, but then there's a smaller percentage where they're not interchangeable. But your pharmacist can tell you about that. Yes, and you want to take Synthroid on an empty stomach first thing in the morning. Just like iron. Does anybody take iron? Iron is also one that you have to make sure you take on an empty stomach in order for it to be absorbed appropriately, because it really takes advantage of the acidic environment in your stomach to get absorbed
Does
appropriately.
not have a history of constipation?
Oh, yes. But, sometimes you have a reason to take it, maybe for short term, not long term. So, okay, so how to store your medications. The ideal way to store your medications are in a cool, dry place away from harsh light or heat. Bathrooms are very humid, so if you have a medicine cabinet, that whole medicine cabinet in the bathroom is not really ideal because it's very humid. And it's just not ideal for the stability of your drugs because of the humidity that could be in your bathroom. For easy open caps, use extra precaution to keep away from children, your grandkids if they visit. Refrigeration often improves the taste and prevents deterioration of the medication. So if there are no concerns, and unless the manufacturer explicitly states it has to be at room temperature, then you can store also in the refrigerator. And note also the expiration date of all medications when you have them at home. Other points to remember. Consistency takes practice and requires incorporation of daily habits. So I would say do an assessment of the current medications that you're taking. Hopefully you are compliant, over 90% compliant. But if you're not, ask yourself why, and work with your pharmacist or physician to see how you can tailor your therapy so you can be compliant. Remember to record all pertinent information that can be helpful to make sure that you are getting the best out of your medications, that it's being effective for you. So whether that's documenting your blood pressure numbers, your sugar, your pain from 1 to 10, or the amount of times you're taking your medications can be very helpful for your physicians. And ask your pharmacist before you combine any over-the-counter, herbals, alcohol, food with your medication, and report any problems to your pharmacist, and always ask questions. There's never a dumb question. So always feel safe asking. right, so I just want to ask you guys a few safety medication questions to see how much you remember from what I said. Is that okay?
Sure.
All right, we'll take a few questions. So, what role do medications have in health? Do they cure diseases, prevent diseases, provide symptom relief, or all of the above?
All of the above.
Very good, see? Medication compliance is important because it is essential to gain benefit from therapy. It decreases drug adverse effects. Medication compliance is not important. 1 and 2 only.
1 and 2.
Very good. Guys are great. Some obstacles in taking medications appropriately include taking multiple medications in one day, taking multiple drug doses in one day, the cost of the medications, all of the above, or none of the above. All of the above. That's what we talked about. Very good. Different ways to increase medication compliance include talking to your pharmacist, ask about the availability of generic drugs, adhere to diet restrictions, use medication reminders, or all of the above.
All of the above.
Right. So if you are taking, if you were just prescribed a new patch, the first thing that you should do before applying a new patch is make sure the old patch stays on. Find a hairy, oily skin area to apply the patch to, or remove the old patch, or none of the above.
Remove the old patch.
Very good. For how long should you wait before applying a second eye drop if you're taking 2 eye drops? Very good.
Yeah.
5 minutes. See, you guys are going to take your medication safe. When applying a cream or ointment, it is recommended to apply a bandage to the area to prevent it from getting dirty, apply a thin film of medication to the area, not cover the area with bandage unless instructed to do so, 2 and 3 only. So
3.
2 and 3, very good. While taking your sublingual, I'll skip that one. Nobody really is taking the nitroglycerin here. And we talked about grapefruit juice and Fosamax. So I think that's pretty much it.
All right. Wonderful. Thank you so much.
Thank
We really
you.
appreciate it.
This
Thank
was really
you.
a pleasure. Thank you so
Do you
much.
have any questions?
Yeah, I have one.
Okay.
Sure.
Because you mentioned the remembering to take your medication, how it decreases with the amount of times, and I know that. I just looked the other day, I missed 3 mornings of my medication.
Yeah.
Is there anything for people at home that they could, like a dispenser type of mechanism for people that don't have a good memory? Is that, I know we have someone from a memory care facility here today, but I know, like, my mother-in-law's 87 years old. She forgets some things.
Right.
And I'm wondering if there's a way so you don't overdose on it.
Right. So have you used the pill boxes?
I use the pill boxes, but that's, I have everything lined up. I have my morning and my night pill box.
Okay.
And sometimes I forget to take it. The other day I took my night medication in the morning. So
Okay. So it's not that it's not there for you to take it. It's just
right,
you're
just
forgetting
like
to take it.
So I was wondering if there was any type of a dispensary unit that's like on a timer that your pills drop. I know it's probably more effective if you're in a single room place
Mm-hmm.
because it could drop in the kitchen and you could be in the living room and not realize it. But
I have not done that research. I'm not available of a specific dispenser for medications, but that's not a bad idea. I know in the hospital we use dispensers for nurses where they go and retrieve the medications, but it's not an automatic dispense. They have to go in and retrieve it. But for home use, I have not seen that. But I would be concerned for that. I think it has to be really used under special situations, because if you have children visiting or pets, they can inadvertently take it, right? If you don't realize it dropped down for you to take and it's just laying there, that's medication that's really unsafe. So that would be one of my concerns, but I wouldn't put it past there that there is some technology now, that there's so much innovation. Yes,
The internet.
yeah.
In lieu of that, right, if you're home and it's happening when you're home, if you use the cell phone alarm reminders.
talked about that.
Or the Alexa app, the Alexa will set
You
an
use
alarm for-
Alexa?
Alexa stopped talking to me a month ago.
I'll have.
She's mad at you.
I am going to go visit Mr. Lochterman's house, and we will have a chat with Alexa.
There you
That's-
go.
But that would, I know many of my friends use those.
Yes, yes. So definitely take advantage of your phone
Yes.
and program the alarms, so you can definitely put it in your calendar.
Good.
Yeah, that's a great
Wonderful,
question.
wonderful.
Thank you.
Need to get the watch, Ed.
Oh, Apple Watch.
They're only as smart as the people using them.
Set up your watch.
Oh, that's great.
Ed, I know
Any other questions? Happy to take.
Put an alarm on your iPad.
Same idea. iPad, iPhone, any smart technology that you have will be just as good.
I know of one that someone is using, but I don't have all that info. We were just talking about it the other day because her mother is close to 100. And she does have someone there all the time. So I'm going to find out the information and I'll tell her.
Very good. And I'll do some research myself and I'll pass it on to Wendy.
Good.
How's that? And you can bring it
Wonderful,
back.
wonderful.
And that will be a follow-up to our presentation. Yes,
We
ma'am.
have 2 questions.
Do any of the multivitamins interfere with any medications?
Yes.
I mean, if you just, I take like a senior multivitamin every morning.
They don't do anything.
Yeah, for the most part, again, it depends on everyone and what else you're taking, but for the most part, no. But make sure you take it with food because it can irritate your stomach and cause some nausea. Yeah.
And Ed, just for an idea, before I go to bed, I have all my medicine things lined up, like facing up, and then when I take them, turn them upside down.
Yeah, see, everybody has their
Yeah,
tips
yeah.
and tricks.
Their own trick.
I
Yeah.
usually don't forget at night. It's the morning.
Right on my pillow.
Yeah.
So, not gonna get in bed.
There you go.
Gentlemen have.
Oh, yes, sir.
I just want to clarify, our complete prescription records are available to all the pharmacies and all the doctors? Would they see a full list if we're using different pharmacies and things?
So, no, not everyone. I would say Walgreens, for example, will have access to the different Walgreens stores, but not Walgreens to CVS.
No.
I went to an eye doctor,
Necessarily.
for example, and they seem to be able to access all my prescriptions to see what I was taking.
So it depends. One of the biggest accomplishments we had in the hospital recently is the implementation of the Epic system, which is very popular in doctors' offices. So, and that was one of the reasons New York Presbyterian went with that system, is because we are able to see from an outpatient to inpatient all of your records. So it's streamlining that, and that's really what our country is aiming for, to avoid interactions and miscommunication about your health records. So that's a good point. Thank you. Yes, sir.
They can't coordinate your records if you go to Mount Kisco.
Mm-hmm.
They don't do the same as Presbyterian.
No.
We can't.
Yeah.
And we expect them to do medication. I don't know. That's
Well,
gonna be a real
CVS,
step.
CVS can do it if you're in Florida and you, and.
Yeah, CVS is
Within,
CVS. That's-
within.
No, it's within the same chain. So I was referring to CVS within all the CVS stores and Walgreens within their CVS stores. And New York Presbyterian, ideally that is the world that we strive for, is that we have 10 campuses. So whether you're at Cornell, Columbia, or Hudson Valley, we will be able to see your medication history and even all of your hospitalization records. So within that same system, you can see that. Yes.
I would just like to make a recommendation to everybody that they always carry their list of medication
Oh,
in their wallet.
yes. Yes.
Yeah.
Oh, my goodness.
I
forgot.
do that, but I also have a list of mine and my husband taped to the front door on the inside.
It is
In
so
case-
helpful.
In case we have to have ambulances or anything come, I don't have to go crazy. It's right on the front door.
Yeah.
Thank you.
That's
That is
excellent.
such
Yeah.
a key treasure tip.
Yeah, I do it right on the
That
front
is
door.
definitely
that's good.
important, especially if you get hospitalized. Yes,
Right.
ma'am.
So here's a question, because some of us are unhappy with a current medical system here, and we wanted to transfer over to you. How easy is it to get our medical records to you?
So there's a process in place. If you contact the specific doctor's office that you wish to go to, I'm sure that they can coordinate that. Whatever is necessary to get your records over.
They would, I wouldn't have to do anything, they would coordinate that, or?
I can't speak to the process. I know that it is,
You might have to pay
yes.
for it.
Because of HIPAA, you might have to sign something for
Yeah.
the previous doctor's office.
Right.
Just- The new doctor's office, you can sign at the new doctor's office and just say, I allow my records to be given to
Right.
Dr.
They must
so-and-so."
Right.
send them.
Right. You have to give permission for that, absolutely. But to the extent that the process is, I can't speak to that. But definitely it is possible. Okay? And they're very friendly at our medical group. I happen to be a visiting patient to one of our medical groups, so I'm not just disclosing it because I work there, but I'm also a patient. And they're very, very helpful. And again, it's helpful that we have the same system on the NYP medical group side, so the private physicians outside, as well as in the hospital, so that they can see everything.
So you can make that request of your particular doctor.
If you're outside of New York Presbyterian, yes.
Yeah,
Mm-hmm.
okay.
Yep.
Any other questions? Wonderful, thank you so much. We really appreciate
Thank you.
I just want to mention that we keep talking about ways that we can help the seniors. We have a suggestion box outside, and any topic or any situation that you would like for us to address, you can put that into the suggestion box. Diana, is that correct?
Yes, that is correct.
You can either sign it if you want a phone number, if you want to be called, or not. It doesn't really matter. You can be anonymous, or you can tell us who you are. But if you have a suggestion, because we are in the process of making up our agendas for the next rest of this year, and we want to be sure we're addressing things that are of interest to our seniors. So, Diana, will you open that up and call me, or what have you, once a week, or once?
I will check it for you, yes.
Okay, thank you so much. You know, there are people, we have wonderful people in this town, working for the town, whether it's Kim over at the office here, which I just talked to her about my star, because my husband and I moved into another address, and or whether it's Jim Moderano, who talks about, here he is, recreation. He's going to come up and say a few words. Diana, we do have wonderful people working. You can reach out to them, and they will help you. So, Jim, do you have anything you want to say about recreation right now? And then we're going to call on the supervisor to come up.
Where did he go?
I told him to come back too.
Hi, everybody. So I wasn't actually going to come up, but Ed said something about the tech. You know, you're only as smart as the person using the tech. So with that being said, is actually the John C. Hart Library on Tuesdays and Fridays for all seniors from 2:30 to 4:30. There's the tech crew, where they'll team you up with a teenager that knows this technology inside and out. And they literally help you with your devices. So if you want to set alarms for your medicine, if you go on Tuesday or Fridays from 2:30 to 4:30 and ask for the tech crew, they'll pair you up with someone that can show you how to use those devices.
Wonderful.
So bring your tablets, bring your cell phones, bring your smartwatches, whatever you have, even a laptop, and they will help you use those devices.
Beautiful, wonderful.
I'm glad,
2:30 to what?
2:30 to 4:30 on Tuesdays and Fridays.
Yeah.
I'm glad the supervisor came back in for that point. Sometimes he might need that.
Yeah.
I want
So our new senior newsletter is up on our Facebook right now. If you want to go check that out, we have a lot of fun and exciting trips. So on the back page of it, there's a save the dates for all of our trips coming up this year. Going to a lot of fun places.
They're out in the lobby also.
Yep.
if they
So
wanna pick
seeing
them up.
plays, just going to Atlantic City. Christmas show, I think San Gennaro feast we're doing as well. So a lot of fun things are going on, and we are still taking registrations for our fitness classes. A lot of the winter classes have just started, but even though you might have missed a week or two, you can still sign up. So feel free to come down to our office or give us a call if you'd like to sign up for any of those fitness classes.
Thank you,
All right,
thank you
thank
so
you,
much.
Thank you.
Thank you. So make use of all of the facilities that we have. Yes.
May I
I
just,
just want to say, stand there. You said how nice the people are in our town. I am, you are. Yesterday, I had to go to Parks and Rec. for signed papers, right? Well, a lady came in from the office and said, "You have a white car?" I said, "Yes." She said, "You have a really bad flat tire." I want you to know at 2 o'clock, he went out and he changed my flat tire.
Oh, wow.
Hope not. I hope not.
But he's lying on the ground, puddles of water, and pouring. Thank you, Jim.
He'll get his rewards.
Nice
He'll
job,
get his
Jimmy.
rewards. Thank you.
Can I just throw out real quick? I know.
Can I just make the, okay.
I just wanted while Jim was talking about recreation, he and I have been working, myself as a liaison for the Lions on the concert series. We will be starting July 9th this year, ending on August 27th with a military tribute concert that'll start a little earlier. And great lineup. All 6 bands have now responded. The dates are set, and we'll try to get that out with Parks and Rec as soon as possible.
Thank you.
Thank you.
No problem.
Okay, we have here our new supervisor, Tom Diana,
Thank you, folks. Thank you so much.
who has been patiently waiting to come out to speak.
Not a problem. There's a couple things I got done.
Good,
I was
good.
waiting,
We're
so
happy to hear that.
It's all a good thing. Thank you, Senior Committee, for allowing me this opportunity to say a few words. And it's a definite honor and privilege to stand here before you and go over a couple of things that are going on in town. As you know, we've had a new garbage contractor that has taken over the town. Please be patient. I was actually talking with him earlier. They're rearranging the recycle routes so that it makes more sense. So that they can go from one section to the other. For whatever reason, they were all broken up. I don't know why the other Carter did that, but they did. Maybe it made more sense for them. But this particular system that he has set up it seems more straightforward, and we will be announcing that. I believe he's doing a PDF or something for the clerk that's going to put it up on the screens or something for us to view. Is that okay, Diana? She just gave me the evil eye, folks, in case you didn't see that, okay? So be looking for that. We hope to initiate that hopefully by mid-February so that everybody knows what's going on. The way I understand it, the last Carter just went and did it and then put some stuff in mailboxes or on the doors, and that's how it took over. But every time this is my third garbage contract that I've been through, there's bumps in the road, and it's not from Dave Pagnelli. Okay, so they're getting ironed out, which is a good thing. So be patient. I don't know if any of you folks have the backdoor pickup, so to speak, where somebody comes and actually picks up your garbage and or recycling from your back door. But that is available. It is an extra charge to the Carter. So if you need something like that, you're immobile, or maybe it's just a short period of time that you're immobilized, due to a medical condition, then you can utilize that on a short-term basis. So yes.
I'm a little confused. Are you changing the days for the garbage, trash pickup and recycling? Or is that what you're saying?
No, garbage will probably be the same day. Your recycling may change.
There may be some partials.
There may be some partial changes, but you'll have to look at the map. That'll be discussed, and I don't know if he's going to mail a map, or you could go on the website possibly, and let's say you live on Underhill Avenue, or you go to section whatever that happens to be, and you'll be able to see what day your recycling is being picked up. So.
Will we be notified as residents of Yorktown? We have to be directed to do that.
That's up to the Carter, but I do believe he's going to send emails. He's going to do a presentation here once he has everything in place. It's going to be on the website. And they may even, wherever the changes are, they may go door to door and leave a slip in the door, but I'm not sure about that, so don't quote me on that.
We're going to put it up on the town websites and everything.
It's going to be on the town websites, yes, yes, so,
However, there are people who do not use the web,
yeah.
so I think that it behooves us to request that they do put something in our mailboxes, perhaps.
Yeah, well, they're actually not allowed to put anything in the mailboxes, so it'll have to be in your front door.
Well, front door.
Or someplace like
Yeah,
that.
he said he was going to do that.
Yeah, he said, so we're gonna work out those logistics so that everybody is advised what's going on. And it's not every route that's changing, it's just certain ones so that it makes more sense. So you go into area A and you pick it up. Then that area is done. Now it's area A is half of area B, and it was kind of a mishmash. So hopefully that will straighten out a little bit of recycling. The trash, from what I understand, is on point for the most part. It's the recycle that is kind of messed up, so. What's that? Yeah. Yeah. New drivers, new. Yeah.
New one come in the bag in, instead of bag all the way into Dead End Street, they just start from there, pick up the trash. But the new people coming, the bag in, they stop, pick up one by one, instead of going in.
Like I said, there's going to be. No, yeah, there's going to be some bumps in the road, but I've seen this time after time after time that every time we get a new garbage company, usually about the first 30 to 45 days, it's.
Even 3 months.
It's, yeah.
Even 3 more months, I have to say
He'll be all set, he'll be all set very shortly, I'm sure. It would sure, my administrative assistant, Jenna, has cauliflower ear from answering all the phone calls with
No hazardous duty pay for her.
No hazardous duty pay.
Okay, please.
Uh-huh.
The truck is so big,
Yeah.
and bag it in and bag it out. I thought to myself, why don't you just bag all the way up, start from there all the way out?
I can't answer that question for you. I'm not driving the truck.
You want me to try it, go every direction, do that?
You do that. After all this happens, I'm going to get your phone number. All right, I'm going to give it to the Carter. I'm having you on behind the wheel. You sound like you could do it.
I miss the old service. I love the old service. It's so nice.
Pretty soon these guys will be the old service and you'll love them too. I hope so.
Okay.
All right, we've had a lot, we've had a lot go on in town. In the very short 19 days that I've been here. We started a little bit beforehand with the sinkhole on Christmas Eve. I'm sure everybody read about that in the papers. And that is now complete. But they're still doing geological surveys there to make sure that there aren't going to be more. So we are keeping Legacy Field closed until such time as those geological surveys are done and we have the reports back and we can report accurately to the public. So that particular one is done. As you all know, we had one of our officers pass away, Kenny Scroy. We posthumously promoted him to captain. It was a tragic thing. My wife and I had gone down to the hospital the day before he passed, and we were able to take care of some things so that we take care of his family.
Good.
Having been a police officer for 25 years, it tugs at your heartstrings to know the 37-year-old man can wake up one morning and be absolutely fine, and 2 days later he's gone because of a bug that we can't even see, probably. So that was another thing that we had to handle. We had some other little things that have taken place in the meantime. I've been navigating them for you folks. Most things you folks don't even see, and it's just taken care of, thank God. We now have our second councilwoman on the board. Mary Capoccia, who used to be Michael Grace's administrative assistant, is now the second councilwoman on the board. She's going to, she was appointed on Tuesday night. She's going to be filling my unexpired term. I am fulfilling Matt Slater's unexpired term, so she's filling mine now. So she's a wealth of knowledge about the town because she's dealt with it for, I think it was about 6 years. Was it 6 or 8 years?
6.
Dave, 6? Mary was here. 6 years?
Yes.
Yeah. 6 years, Ed? Yeah.
Yeah, Michael did 3 terms.
And, you know, I'd be remiss, and he'd probably remind me of it if I didn't say it. I want to introduce you to my new deputy supervisor, Ed Lachterman.
We're trying to conserve taxpayer dollars. I'm good.
We'll have to talk. We'll have to talk to the clerk about that. He's not getting a new one. Okay. I don't even have one yet. You know what the heck? But yeah, we've navigated some obstacles that have come our way in the past almost 20 days. The last one, it first came in as another sinkhole. On the pipeline, we have 2 pipes that run vertically, and one that crosses. The one that crosses is a sewer line. The sewer line broke. We don't know what's underneath yet, but we're not going to speculate that it is a sinkhole. It may just be a broken sewer line, but it's a very large sewer line. It's in between Dunwoody Court and Campfire Road. That's where the pipeline runs. We have Enbridge on the scene. They have mobilized excavation equipment because we're not allowed to dig on the pipeline. Even though the pipeline is 10 feet below where we're at, they have to do it. Because basically we don't want to go boom. So that will be repaired. We have redirected most of the sewer to another location. What they're doing is they're letting it fill in a manhole, pumping it into a truck, and they're bringing it to another location so that sanitary conditions remain the same. And they'll be there through the weekend, so anybody in earshot of this or any of your friends that may live over in that area, you may want to just let them know that, you know, there should be no disruption in sewer service, you know, hopefully for the weekend. And
Okay.
I think that's probably about...
Okay, does
Oh,
anyone
hang
have
on.
any questions for the supervisor?
I just wanted to add 2 things to your comments, Tommy, if that's okay. You spoke about Captain Scroy, and the chief had made a point, since they're always in the room. Wendy's back there. The New York Presbyterian family went over and above in trying to help Kenny, and both up here and in the city.
Yes.
And they did a phenomenal job, and I know that the chief would want us to pass that on, as he had mentioned both at the wake and the funeral. So
Yeah, we want to thank New York Presbyterian. They actually, not to jump on Ed, NYPD actually transported the life-sustaining devices from Columbia Presbyterian in the Bronx up here, where they administered, I don't know what they were, did what they had to do, and then they lights and sired him down to the Bronx, where they did whatever they had to do down there to try and sustain his life, but unfortunately he succumbed to the illness, which was a shame. But we want to thank Columbia Presbyterian and New York Presbyterian for all their efforts. It was a, you know, they say it takes a village.
Mm-hmm.
It did.
We're
So.
always here for you guys, and we're so sorry to the town and to the Scroy family for this devastating loss. But
Yeah.
we're always here.
Thank you, Wendy.
Thank you.
Thank you, Wendy. That was great.
And the second thing was just, if you do have any issues with your trash, please let us know. I know the supervisor and I and some of the other council people have actually been having the weekend date night with our spouses, driving around town.
Yeah.
Making sure trash and recycle have been picked up. Ironically, I called for an area that is close behind me, what I call the State Streets, over by California, Indiana. And when I called the hauler, it was a Saturday night at 7 o'clock. He was like, "Oh, it's funny you're calling me. I'm right behind your house." And sure enough, when we drove around, we came across them trying to get the job done. But they've been very, very receptive to the input, to getting things done. They're really trying to get it there. But if we don't know about it, we can't help it. So you could feel free to email us, call us, the supervisor's office, refuse and recycling, any of the council people. We've all been trying to help and assist, so that is definitely
Your most direct call would be to the Carter. That's your most, because we're just going to have to pick up the phone and call him anyhow. Not, if you can't get through, you have a problem, your most direct line would be to him, or to them, I should say. Jenna, do you have that number on the top of your head by chance?
Yeah, I know it's 4555 junk, but.
I believe it is too.
No, I'm serious.
Oh, my.
Yes, I think it's 914-455-JUNK. Also, like Ed was saying, we have been, Ed and I have been talking trash most of the weekends as we're following the garbage trucks around, and just trying to find out what was picked up, following up on our emails, following up on our phone calls, etc. And he's been very very helpful in getting the areas taken care of. Going back to Lieutenant/Captain Scroy, I want to thank everybody who had said prayers for him, et cetera, and especially the New York City PD and all the area PDs and FDs that came out and supported him. I don't know if anybody had seen the outpouring of support that we got from our fire departments and police departments throughout Westchester County and New York City.
Wonderful.
Amazing.
That's wonderful.
Absolutely amazing. Seamless.
I have the number for competitive karting, 914-762-1900. Competitive karting.
I don't think that one's
That might be
up.
their old one.
That might be their old one.
That's their old one?
Maybe, yeah.
All right.
Definitely. I did 455 junk, right? Is that what it was?
It's 477.
477 junk.
477
I
junk.
think this
Okay.
gentleman here had a question for you.
Does anybody else have a question for me? Go ahead, Francis.
One thing, I think we should change that thing from, it shouldn't be garbage, it's sanitation. Number two, what are we doing with the fluoridation?
Here he goes.
To the New York town?
Oh,
Where
boy.
are we? I know, it's a problem. It has to be dealt with now, because it's coming up for vote, it's coming up for discussion.
Pardon me. The fluoridation project in Yorktown here is probably, and I'm going to be 100% transparent and honest, is my least favorite project that we have taken on in the past several years. This has been going on for at least 5 years. It's just about ready to go online. There are some nuances that they have to overcome. I believe they have to do a water test. In other words, before they put fluoride in the water, they test how it is injected, et cetera, with water to make sure it works, and then they bring these vats of fluoride in. It's interesting that this project has taken this long to complete, because the grant was for X number of dollars, and it exceeded that. So the town had to put it out, and the town will be putting out for it continually with O&M, probably be somewhere between $30,000 and $50,000 a year to keep that fluoride project up. And it's a double-edged sword, because you have on both sides, you have people that say that it's good and people that say that it's terrible. So, it depends on what article you're reading or who you're talking to that it's good or bad. So, I'm not a dentist, I'm not a doctor, I can't say either way. But hopefully within the very near future, for instance, that's going to be up and running.
But have they looked at the studies at all? You said how many years now?
It's been 5 anyway. No. Well, I'm not sure, but, we had supposed noted authorities in here to say that it wasn't bad and so on and so forth, but you hit them back with it to say, well, what about this and what about that? And they try to go back and forth, and quite frankly, I voted against it. I have voted against it going through. I believe with the with what that particular product is, that it's not good. It's actually a caustic type of substance that our Joint Waterworks department actually had a problem with and don't want in their building anymore. But with the outcrying of the folks, it was passed. We had a $900 and I think it was $80,000 grant, and it exceeded that by about, at this point in time, by about $200,000 or $250,000, if not more. So I made the analogy at one point in time that, we need pipe relining. We need these pipes scraped out so that we have enough water flow in them in case there is a fire, that we are able to put that fire out. And the analogy I used was someplace up on a hill somewhere, you're going to see people standing there with great teeth while their house burns down because we can't put it out with the water.
One thing, that hasn't been proved that it does that for the teeth.
I like I said, I can't argue whether it works or it doesn't. I'm not a doctor, I'm not a dentist, but I only know what I read. So.
Okay.
I
But it-
posted a good.
Moving right along.
I saw
Told
it.
him not to bring this up. I told him not to bring it up.
Yep.
Told him not to
No,
bring it up.
I'm just,
It was to the point where we could not, you couldn't back out of it, otherwise we'd have to pay the money back.
it
So-
does come down to the money.
Yep, it comes down to the money.
Thank you.
right.
Okay, thank you.
Oh, we can take. Oh,
All right.
okay, thank you, folks. It
Thank
was
you,
an honor
Mr.
and privilege.
Supervisor. Thank you very much.
Thank you.
Thanks, Tom.
Okay, we'd like to introduce a very shy.
I gave you how many kudos up here? Thank you. Great job,
Introduction.
Supervisor Diana.
We're going to introduce
All right.
our very shy highway superintendent.
I just wanted to stop in
Paganelli.
and give you a quick update on what we're doing. I'll be brief. We're addressing issues up on Hill Boulevard. Okay, I know some of you might live around that area. Particularly the island in the center. Why we know we had a person have a slip and fall there because there are some holes developing there. We're trying to ascertain whether it's Con Edison or it's town drainage. So either way, we're going to fill in those holes. But in the interim, I just recommend you use the crosswalk that we put in a number of years ago. Takes you over to the medical building. So I'm going to give you a new term. You're going to know this, and you could dazzle your friends with it. Does anybody know what a skip line is? Okay, so on Lee Boulevard, okay, as you're heading towards, say you're coming out of Jefferson Village, out of Hill, making a right on Lee, and you go in front of the mall. There's those dashed lines that indicate where the lanes are,
Right.
which are barely visible at this particular moment, so it's very hard to tell where the lanes are. So back in the middle of December, I had gotten a purchase order for $3,700 to, those are called skip lines, that's their actual term, to replace those and indicate where the turns into the mall and onto Strang Boulevard were. So as soon as the weather is cooperative, that'll get done. At the end of the island in front of the Mohegan Firehouse there, when we did the rest of the double yellow line all the way up to Quinlan, the company was supposed to take the two lines that came off the end of that island, bring them together, and then put a hashed line so that people, when they come up at night, it's kind of dark there, they know which side of the island to go down, rather than go down the wrong side. So, and then next year, I'm hopeful, my plan is to continue to increase fog lines. Now, I'm a senior citizen, all right?
No.
Yes.
Yeah.
And that-
68
and that's
years
so.
old. I am a senior citizen. So And my wife was the impetus for this. She said, Dave, at nighttime I can't see for anything. She goes, and I can't see where the edge of the road is without those white lines there. I said, well, honey, those are called fog lines. I said, so that being said, we're trying to incorporate more and more of those because they do help. There's a turn on Quinlan as you come down right by Meade. And there have been 4 accidents there in the last 2 years because the double yellow line separates and there's no dash marks in between it. So people who are trying to see the double yellow line, all of a sudden the line disappears. So there's a lot of stuff like that that we're sort of addressing, trying to help, all of us, not just us seniors, all of us with respect to that. So that's it. I'll be brief. Questions?
No.
Okay, good.
Thank you.
I know you guys have been
Thank
here a long
you,
time.
thank you, Dave, thank you.
Keep up on the good weather, Dave.
Oh, yeah, the weather's, I'm so sorry about the weather. The weather's been a bear.
Try to do something about it.
Thank you.
We just need more hope.
Okay, well, thank you all, you've been very patient. And once again, if you have any topics you would like to discuss or have us look into, suggestion box outside.
Rosemary,
Carol is going to talk to us about tips.
just very quickly, I just want to mention that we have the TIPS program here in the Nutrition Center on Mondays, 9 to 11. TIPS is Telehealth Intervention Program for Seniors. I know my husband and I come. They take all your vitals. Those vitals are sent to a nurse. They are put on a program. And from this program, they're able to tell if there's something going awry so that you can be contacted before you have to have some terrible thing happen to you. So I would just suggest or hope that you all come Mondays, 9 to 11, in the Nutrition Center to have your blood pressure checked, and you can also talk to a caregiving coach. Okay, thank you.
Thank you very much. Thank you, Darrell. Okay, thank you all for attending. We hope to see you. And in the meantime, we wish you a happy Valentine's Day, which is the 14th. So we look forward to seeing you then. Thank you so much. Thank you for attending.